Straighten up, you pathetic pains in my butt. You! What are the two types of hemorrhoids?
Internal and external, sir.
Very good. How are these two types differentiated?
The location?
More specifically, their position with respect to the what?
The dentate line?
Yes! The dentate or pectinate line, which divides the upper 2/3 and the lower third of the anal canal. Which of these two are more painful?
External, sir, as they are innervated by cutaneous nerves. Internal hemorrhoids are innervated by visceral nerves and therefore lack pain receptors, sir.
Very good. Now, if only there were some sort of cream to get rid of you! Now get out of my sight! You think I'm scary? Just wait until you're knee-deep in the pit. Then you'll really be wetting your pants and crying for mama. A patient arrives in the ER after being in a motor vehicle collision. Blood is squirting out of her leg and she's complaining loudly about her pain. What are the priorities in assessing this patient? Go!
Hey, airway. The patient is talking, so the airway is intact. Sir.
Very good! You!
B, breathing, sir. Auscultate the lungs to rule out pneumothorax or hemothorax, sir.
Are you kidding me? What about the blood shooting out of her leg? Do you want your patient to bleed to death?
No, sir.
He's tricking you. Breathing is correct. The patient's breathing is far more important at this moment. C, circulation. Stop the bleeding is last.
Very good. I like a woman who can challenge me.
Why didn't I think of that?
Would you mind assisting me with this next question?
Sir, yes, sir.
Good. Okay. A baby chokes and vomits with feeding, occasionally showing signs of cyanosis. A chest x-ray shows an air bubble in the stomach. What is the condition?
Sir, tracheoesophageal fistula, sir.
Correct. TE fistula is a common congenital abnormality associated with copious salivation, choking, coughing, vomiting, and cyanosis. And how is it treated?
With surgery, sir.
Also correct. It is surgically corrected with ligation of any fistula and anastomosis of any discontinuous segments. Thank you for your help.
How did that help?
Well, I feel more relaxed. Don't you? Okay, you peons. It's time to see if you've been paying attention. What is the difference in the level of consciousness between someone who has delirium versus someone who has dementia? You!
In delirium, there is a waxing and waning level of consciousness, sir.
Good! And in dementia?
There is no change in level of consciousness, sir.
Also very good! And unless you want to be knocked unconscious, I suggest you wake your sorry butt up! What are you two waiting for? Since just looking at your ugly faces gives me a killer headache, you're gonna name me the most likely cause of the headache. If your patient has jaw muscle pain when chewing.
It's temporal arteritis, sir.
Correct! And if the patient has bilateral frontal or occipital pressure?
That's attention headache, sir.
That's right! And if your patient complains of a headache before or after orgasm, what are you, 12? Never heard the word orgasm before? The answer is postcoital cephalgia. That is it!
Oh!
Don't just stand there, nitwits! You mangy good-for-nothings wouldn't know an endocrine gland from an exocrine gland. Quick, name the side effects associated with pituitary adenoma. Go!
Amenorrhea, sir.
Go!
Low libido, sir.
Go!
Bitemporal hemianopia, sir.
All correct. And galactorrhea. Oh. What? You've never seen a man lactate before? You're doctors. You're bound to see a lot stranger things than this.
It's so funny. It's so funny.
You are the most pathetic group I have ever seen. I wouldn't trust a bedpan to you, let alone a patient. As you should know, ego defenses are the unconscious mental processes used to resolve conflict and prevent feelings of anxiety and depression. I'm sure you know your share of anxiety.
Sir, yes, sir!
Name one immature ego defense.
I don't know.
Regression. That's one. What about you?
I don't have to put up with this. This is a hospital, not a boot camp, and you are just a big bully. I'm out of here.
Acting out. That's two. Can you name one more? Are you up to it?
The question is, can you name me another ego defense?
Identification. That's three. Good job. Now get down and give me 20.
You get down and give me 20.
I don't have to do what you say, you do what I say.
I don't have to do anything you say.
That's it. I'm officially ashamed to have you on my service. Since you all insist on being a bunch of babies, give me the developmental milestones of a child. 3 months. Go. Good. Laughter and hands together is correct. 12 months. Go.
Stand.
Good. Stand in 1 to 3 words is correct. 3 years. Go. Yes, that's correct. Jumping forward and dressing. Now, if you don't all get out of my sight in the next 5 seconds, you'll wish you were never born.